One of the most important mechanisms for ensuring the provision of trauma-informed care is supervision. There are two aspects of supervision that are important. One is providing supervision in a trauma-informed manner, and the other is using supervision to promote trauma competencies. In order for the supervisee to feel comfortable sharing their difficulties with the supervisor, the relationship must be safe. It must be empowering so that the supervisee feels confident and competent in doing the work. To create and maintain this kind of relationship, the supervisor must be aware of how the relationship is affected by what they say and how they say it. The following are guidelines for creating a safe and empowering relationship. The relationship between a supervisor and a supervisee is influenced by the culture that each person comes from. By culture, we mean attitudes, beliefs, values, assumptions, and behaviors that a person has learned as a result of their origins, social groups, and history. A trauma-informed supervisor maintains awareness of their own culture, as well as those of their supervisee, and pays attention to and acknowledges how these affect the relationship and their work. A supervisory relationship is one in which the supervisor has more power than the supervisee. Therefore, it's especially important to be respectful of the supervisee's experience and point of view, even when it's different from that of the supervisor. Supervisors must be honest, but the honesty must be tempered with kindness. A supervisor needs to be able to speak directly to a supervisee about the areas of work where they still have learning to do. However, a trauma-informed supervisor will communicate the expectation that the supervisee will improve over time. Supervisors must also be fair, giving all supervisees equal treatment, even when some supervisees are more likable than others. A trauma-informed environment focuses on and builds on people's strengths. In supervision, this means noticing and acknowledging what a supervisee does well, rather than addressing only the areas that need improvement. When a person is upset, they do not do their best thinking. When a crisis occurs or a supervisee makes a serious error, it's natural to become upset. A trauma-informed supervisor will take at least a moment to calm down before addressing a difficult situation. More time may be taken if an immediate response is not required. The goal is to be able to evaluate and discuss the situation in a calm manner. This is good modeling for supervisees and leads to better communication and more productive problem solving. One goal of supervision is to encourage self-reflection and emotional self-awareness. This is sometimes called reflective supervision. We want staff members to be aware of what they are doing and why they are doing it. Asking questions and listening closely encourages people to self-reflect. In addition, asking questions prevents misunderstandings that result from mistaken assumptions. The goal of supervision is to enhance the skills of the supervisee. For this reason, it is a better practice to elicit solutions from the supervisee than to tell them what to do. If the supervisee cannot identify any potential solutions, it's good practice to brainstorm a number of solutions and discuss the pros and cons of each. A good supervisor allows a supervisee as much choice and control as possible. In the course of our work, we are exposed to painful circumstances and difficult situations that naturally stimulate feelings. Sometimes these feelings can accumulate and affect our attitudes, behavior, and well-being. It's important for a supervisor to be aware of and acknowledge the impact the work has on all of us. A trauma-informed supervisor models good self-care and supports supervisees in finding and implementing self-care strategies that work for them. Self-care strategies include, but are not limited to, work-life balance, setting appropriate boundaries, and using peer and professional supports. A good supervisor is aware of the trauma competencies of each supervisee and works to ensure that each supervisee masters these skills over time. Using questions and feedback as well as modeling, A trauma-informed supervisor encourages supervisees to become self-reflective, evaluating their own use of trauma competencies and strategies. With increased awareness, supervisees are able to expand their ability to respond to participants in a trauma-informed manner. This results in a sense of competence and connectedness in the workplace, and in turn contributes to an overall sense of safety and comfort in the environment.
Hi Kelly, how's it going?
Pretty good, Lori. How are you?
Good. So, how's your week been?
Busy. Had
Yeah.
a lot of people come in this week, but hanging in there.
Okay. Well, you know, I need to talk to you about the records review that we did last week. We've
Okay.
been looking at charts. You know, we're going to have a site visit soon, and I noticed that you're pretty behind in your paperwork. Now, you know, is that a surprise to you, or are you aware of it?
It's not that much of a surprise. I kind of had a sense that that was going on, but I've just been so busy that I just kind of pushed it aside. I'll get to it later, and apparently later is now.
So, you know, I know you are doing a really, really good job with your clients, and you know, I want to sort of compliment you on how I know they're important to you, and I know you are doing a good job, and I know, you know, everybody is being seen, and, you know, so I just want to say that I appreciate your work and how hard you're working and what a good job you're doing.
Okay.
But we do have to figure out how to also get the paperwork done, because, you know, that could get in our way in terms of funding and all those other kinds of things. So the paperwork has to get done too. And I wonder what ideas you have about how you could get caught up.
Well, I guess the hardest part for me is I prioritize my clients because I didn't really come into social work to do paperwork. I know it's part of the job, but I have such a hard time if a client comes in crisis. I want to see them, and I'm going to sacrifice the paperwork. So I don't really know ideas what to do other than, I guess, sticking to my guns and being really mindful of prioritizing paperwork, but it just doesn't feel natural. It doesn't feel good.
Yeah, right. I know that, you know, I totally agree with you. In truth, I think it's more important that we get good care than that we document good care. But we do have to remember that our ability to deliver good care would be, you know, that it would be a problem because, you know, when they come in and audit us, if we don't pass the audit, then we're going to spend a lot of time dealing with the audit thing, and they might not give us as much money, and then we might not be able to see as many people. So in fact, getting our paperwork done, although it doesn't seem like it's that important,
Right.
it really does support the work.
Okay.
So, and mindfulness is good, but maybe mindfulness isn't enough, because my sense is you're pretty mindful.
Yeah.
I mean, when I brought up the paperwork, you didn't say, "Oh, really?" You know, right? So you're not paying attention. You just
Okay.
haven't yet figured out how to fit it in.
Yeah.
So thinking about your typical week, is there a space in there to put paperwork?
I would say if I had to pick a time, usually I don't schedule clients until when I come in at 7:30, I don't have a client really usually until 8. So I do have that half hour where I could start to be really intentional about making sure prioritizing paperwork during that time, and then maybe setting a time at the end of the day as well. But then things always seem to get pushed back, so maybe that's not ideal either, because if I'm saving it for the end of the day, I typically run over on appointments, or I got to make all those phone calls, and I do those instead of the paperwork. So I guess if I had to pick a time, I probably should do something either probably early afternoon. I don't know.
Okay. Well, so it sounds like the morning time is a pretty good pick.
Yeah, that's usually always open.
Okay.
I don't necessarily want to see a client at 7:30 in the morning, so I'd rather get some paperwork done, and that feels better to me.
Okay, so that sounds like an easy one, but it's probably not enough
Right.
to get you caught up. So let's think about, so you said early afternoon.
Yeah, I was kind of just throwing that out there because kind of eliminated the end of the day. Like, I would prefer the end of the day, but I am also realistic enough to know that.
Yeah, that's really good self-awareness,
Thank you.
because I think it is good to realize that we all have limits, and that one of your limits is things end up building up. So some thoughts, and if you have thoughts, you volunteer them too. So one idea might be, what if you scheduled your first client a little later?
Would you say, like, kind of thinking about everything I have to catch up, would you say, like, giving myself an hour each morning? Or
If you did an hour a day, I think you would catch up. And I've been on top of it enough so that we have a fair amount of time before the audit.
That isn't, like, crisis yet.
Right. So if you started really focusing on paperwork for an hour in the morning, would that fit in your schedule? So if you scheduled your first client at 9 instead of 8:30, would that work?
I think so. Because that way, I guess what appeals to me about the morning is that more than likely no crises have come up yet, so I can kind of focus on there. I'm not distracted, unless, of course, I get some crazy phone call that I'm checking my voicemails in the morning and someone's in crisis and I feel like I have to attend to it right away. That would be something that might trip me up a little bit. That if I come in the morning and then I'm prepared to do my paperwork, but I'm checking my voicemails and so is needing an emergency appointment, I might tend to that and be distracted with the paperwork.
Do you think waiting to check your voicemail till 9 would work?
In theory, yes. I would have to be really intentional about it.
So let's talk about the difference. How much of a difference does it make to your client in crisis if they hear from you at 8:30 or they hear from you at 9?
Depending on the client. But if I'm thinking, I think I get really emotional about it. Like, I care about my clients, and so I'm like, oh my goodness, they're in crisis, and if I don't call them back right away, they're going to think that I'm not mindful of what their needs are, and I don't want them to feel like their crisis and their needs are important. So that's like my emotional side wanting to do that. But I think if I rationally look at it,
Right.
probably...
Well, I'm suggesting you don't listen to the voicemail until...
Like, just completely disregard it?
Yeah, like, don't do your voicemail till you've done your paperwork.
Okay.
Because I think it's legitimate and real, and that part of you is important, that emotional part. That's part of what makes you good at what you do. But I think that part of you, once you've heard the crisis, is gonna
get ramped up.
Right. And it's gonna be hard for you to focus on the paperwork.
It's very true.
But it wouldn't be unusual you could even tell your clients, I start work at 9.
Okay.
So at 9 o'clock is when I listen to my voicemail.
That feels actually a little bit better.
So that they even know that's when you get information. And so they would not be surprised then if you don't call them back till after 9.
That actually, like, it feels better to think about it that way. Because I guess I just don't want them to feel invalidated. Like, I didn't want to call them back right away because their crisis wasn't important enough. But if the expectation is I start checking voicemails at 9, that's when you can expect follow-up after 9. That actually, like, it feels very respectful then. Like, they know, like, what's coming.
Right. And that's good boundaries. No one really, it is not actually appropriate for people to expect that you're available 24/7. And so here they know, okay, 9 o'clock is when you're going to check your voicemail, and so I think that makes sense. And then that will give you time to do your paperwork in the morning.
Yeah.
And does that, and moving, I realize that moves things back half an hour from what you're doing now or whatever, but do you think you could still do, meet your productivity and everything with just that half an hour shift?
Yeah. I really think that probably is the best, because if I was trying to do, like, leave the hour at the end of the day open, I don't know. Yeah, I'm trying to, like, process that all. I think that should work as far as meeting everything.
Okay. And do you need, so what supports could we offer to make this easier for you? Is there anything else I can do to support your sticking to this plan and getting moving on your paperwork?
Well, I think the accountability pieces, because like what you said before, like I am mindful and I'm aware of what I'm doing. I just don't necessarily always follow through. So like that kind of check in a little bit, not micromanaging, but just kind of like checking in and encouraging to stick with it,
Okay.
I think is helpful for me.
Okay. All right. So the next time we meet, I'm going to expect a report from you. And the report should have two pieces, not you know to write this out or anything. You could if you wanted.
Right.
If that would help you, you could do it. But just how many charts have you completely caught up,
Yeah.
over the course of this week? Because, we've red flagged all the things that are missing or whatever isn't done in each
Okay.
chart. So, I want to know how many charts you managed to get through in the coming week. And I want to know that for two reasons.
Okay.
One is as a way to give you that accountability, to see that you're actually doing it, but also to see if this plan works.
Okay.
Because if not, we may encounter some barrier or other. And so if it's not doing it, because that'll help us predict how long it'll take you to get caught up. So,
Right.
so if it's not really working, then we can talk about what else to.
Okay.
what
Yeah,
else
because on
to do.
paper it sounds like it
Right.
should work.
Right, but we don't know, sometimes things don't work quite
Right.
the way and it sounds like you have anticipated your own emotional barrier, and we've sort of dealt with that by you're not actually listening to the voicemail till you've done the paperwork,
Right.
so that you won't get distracted from that. But there may be other internal or external barriers we weren't expecting.
Clients show up and wanting to be seen right away or whatever. That's another one that may come up, is sometimes you have those clients in crisis just presenting to the office.
So how could you handle that?
Well, we could have our in-house staff see them versus me if we weren't scheduled, or meeting them in the lobby, like validating that, okay, here you're in crisis, and then letting them know, similar to the voicemails, I'm not available till after 9 to either meet with you or to address this.
Could you do that?
I think so. I think knowing that I have the backing of you too helps, that I'm not being insensitive to clients, or I'm not being lazy, or not being aware of clients who need something. So knowing that I have your support in that actually helps quite a bit as well.
Okay. So you said we could have our in-house staff do it, or I could go out and tell them I'm not available till 9, but this is when I'll see you.
Yeah.
Which of those two plans do you like better?
Probably, I'm caught on both of them because I don't want to inconvenience in-house staff, even though that's their role. They might have paperwork to catch up on that they were planning on doing. And I don't always, sometimes I get wrapped up in the conversations in the lobby. Like, even if I go and intend to be like, hey, I'll see you at 9. When you're in crisis, you want to talk about it. And so I kind of get caught up and then get distracted. Plus, similar to a voicemail, I would then have that in my head, what's going on.
Really good self-awareness. Really good self-awareness. So here's a question. What is the job of in-house staff?
In-house staff is there, like, they are kind of like on call. Like, they perform their regular duties, but they're there in case a crisis comes up. So I guess that technically is their job then.
So how do you think they would feel about you not letting them do their job?
That's a good point. Probably would get on my case and be like, hey, you're stressed out, you're trying to do too much, and they would probably kind of call me out on it a little bit, that that's what they're there for.
Right. And they're not going to feel competent if we don't trust them to do their
true.
jobs, just like we trust you to do your job.
That's a good point.
So maybe that's a better plan?
Yes.
Okay.
Eliminates that emotional
That's
piece
right.
and
That's
also
right.
supports the team dynamic.
Right. And we like that part of you, but sometimes is not the most useful. The part of you that makes you really good at the client work, but also, needs to have boundaries around.
Right.
Yeah. So I think we've come up with it, so
Yeah.
let's let the in-house staff deal with those before work crises, and you do your paperwork in the morning, and I expect a report of what gets done this week.
And that's helpful.
Yeah, and then we'll revise the plan if we need to, but
Okay.
let's start with that, and I think you're doing a good job, and I don't want to end up focusing. I hope we don't have to have these conversations too often, because I don't want to focus on the paperwork either.
Okay.
But it is what supports your position.
Yeah.
And so we do have to figure it out. So I appreciate your engaging in this conversation. And
Yeah.
that plan feel okay to you now?
It does. It actually feels better than I thought it was going to.
Okay.
'Cause I hate change, but I feel this is doable.
Okay. Great. Well, we'll see how it goes, and
Okay.
we can always adapt it if we need to. But
Sounds good.
next week we'll meet and we'll talk about it again.
Sounds good. Thank you.
You're very welcome. Take care.
Yeah, you too.
So this scenario may seem familiar to many of you, and it is one of those occasions where a punitive and controlling response may be sort of what gets attracted, particularly if the supervisor hasn't planned for this. So one of the things about being trauma-informed is that as a trauma-informed supervisor, I've been monitoring Kelly's paperwork to make sure that it's getting done long before audit time comes. So I'm really not at crisis when I have this conversation with her. Even so, I sort of made a mistake in that first scenario, because normally I believe it's a good idea to begin with saying positive things. But I was a little bit focused on needing to address this, so I didn't do that right away. Didn't really matter, because once I became aware of it, I remembered to inject as many positive affirmations of her work as I possibly could, to balance the fact that I was going to be asking something different from her going forward. In the end, I ask questions and elicit a plan from her that works. And I pay very close attention to both the internal and external barriers that she alludes to that might prevent her from implementing the plan. So I'm really looking for the other side of her ambivalence, what might get in her way, and exploring that so that the plan that we eventually develop really does meet her needs. One of the things that may or may not be obvious is that doing it this way is a little bit like doing trauma-informed treatment planning with a client. So she actually gets to see how I would direct a client towards coming up with a plan themselves, and has the experience, I think, of eventually coming up with a plan that feels okay to her. And you can tell by her body language and the way she talks that she's pleased with that session and kind of relieved by the end, rather than feeling uncomfortable. As I'm doing this, I'm also becoming aware of her trauma competencies, and one of the things I'm concerned about is whether Kelly herself is doing a good enough job of helping her clients to build skills, or whether instead she's solving their problems for them because they always come at crisis time. And that's something I don't address in this meeting, but I have it in my mind that that's a competence I may need to build with her going forward. We also have a brief discussion of boundaries, and probably that will be followed up later by more discussions of boundaries, trying to help her to recognize where the appropriate boundaries are and to get more comfortable setting boundaries with her clients. This trauma-informed approach to addressing this problem builds her competency and also preserves the safe relationship with the supervisor. Having had this experience, I think it makes it more likely that if Kelly is struggling with something else, she'll bring it to my attention rather than trying to solve the problem on her own. Good morning, Mike.
It is a good morning, I hope.
Okay, so tell me.
Had a rough night.
Tell me what happened.
Clarence, our African-American resident, there's just been a lot of tension on the unit because he's the only black guy in the unit. All the other guys are white, and so he's feeling like there's some racism in the unit, and he's a little defensive. But my job is to not make exceptions and do the rules, and I've been applying them the best I can. And last night he just went off on me because he was out of bed again. So, I told him that he was going to have to be discharged. It's against the rules, and he wouldn't go back to bed. He just cursed me out and called me things that were disrespectful. I don't know what else to do. Mm-hmm. I'd hate to see him just be discharged, but he's breaking the rules, and all the residents see that, and they're complaining not because he's black, but because he tries to get out of following the rules. So I'm not sure what to do.
Yeah, it's pretty challenging.
I almost regret telling him that he was going to be discharged because that just set him off.
Mm-hmm. Do you regret it because it set him off?
Well, I think it was the wrong thing to say at the time. He was already emotionally charged and defensive, and as soon as those words came out of my mouth, I kind of wished I could take them back. But
that's great. I mean, actually, I think I'm impressed. That you were aware. That what you said to him really wasn't the right thing. So that shows how much attention you were paying, both to your internal sort of state and his, and his internal state. So it's great to know that that wasn't an error of perception on your part, that you were actually reading it right. So what were you feeling when you said that to him?
Well, I was feeling some anger because I was being challenged, and I was thinking the power and control thing, but I felt some anger. I have to think about a little bit because there's.
So what do you mean by the power and control thing? You were feeling
that he was trying to get his way by being defiant, not following the rules, and I had to be the one in control. But after I said that about the being discharged, I felt a little irresponsible, really. I mean, as soon as the words came out of my mouth, I thought that was not the right thing to say. And looking back, I'm thinking I should have tried to de-escalate his anger, and so I feel a little guilt about that. And I don't think it's over. I don't think we have to discharge him right now. I feel like we can do some damage control with that.
That's great.
So
I totally appreciate the amount of self-reflection you're doing, and how easily you're looking at your part in this. That's not always the response I get from supervisees. So I just want to name that your self-reflection is really good, and also your willingness. I mean, it's fascinating to me, actually, to hear you talk about the power and control thing, because that's something that comes up for all of us, often in this situation, it's almost like a reflex. Like, I'm supposed to be in control here, and I'm not. And so the way to get control is to bottom line somebody, or, and I think that's a kind of natural reaction. I think it happens, it's sort of written into our culture or something in a certain way. But usually when people do that kind of thing and then I talk to them about it, they don't necessarily realize that's what they did or why they did it. So I'm really appreciative of your ability to process this. And I think also that your conclusion is correct, that just because you said that to him doesn't mean we have to do it. And that in fact it's good teaching for him. And you can tell me how you would feel about this, and maybe this isn't the moment to have this conversation. Maybe it's after we finish this supervision, but I wonder what it would be like for you after we've sort of sorted out what we think is going on in general, to actually talk to him and say, I shouldn't have said that, and I'm sorry, that wasn't the right response.
I can do that.
Yeah, that's great.
Yeah.
Yeah.
I am a little worried, because a lot of thoughts went through my mind, and I was going to accuse him of playing the race card all the time, which just I think would have inflamed it. But I don't know. With me being white and all the residents being white, I don't know if we can make him or help him to feel safe or not think that way. That was one of my questions that I had for you is, what kind of intervention or what kind of strategy could we have that would address the whole racism issue?
Mm-hmm. So
I don't want it to blow up.
No, we don't want it to blow up, and it's already obviously creating lots of ripples within the program and within you and within him and all kinds of things. And so no, we don't want it to blow up. So just off the top of your head, with no investment, what brilliant ideas do you have about what we might do? As out of the box as you want to go.
Well, I think the counselor in me wants to get at the feelings underneath his anger. If we could get him to talk about his hurt or his distrust, and validate those feelings that are, beneath his defenses. I mean, that works in a lot of situations when you validate those. I don't know if he trusts me enough to allow me to go there. I don't feel like I won the right to be heard with him. And this might have, I don't think it's burned a bridge, but it certainly has damaged the bridge. But my first inclination would be to try to get at his feelings and validate them so he could feel safer. I don't know if that would work, but.
Okay, so if you're not trusted, is there someone in his life that's trusted?
Well, he has an older brother. And he looks up to him. His brother's been successful, and so I think he would listen to him. I don't know where his brother would be on this, if he'd be willing to be involved or not, but that would be that'd be a resource, I think, possible. I don't know how the other guys on the unit. I don't think he trusts anybody on the unit right now. So I'm a little bit kind of looking for ways of dealing with it that I'm not sure would get through to him.
So can you imagine what we might do with everybody to address the race issue?
Who? Well, my first choice was not to be by myself
Oh,
when
yeah.
I'm doing this.
Yeah, I'm thinking of something
Okay.
we would literally do with everybody.
No, I meant
All of us
I'm
together.
sorry. Oh, all the staff.
Yeah.
Oh,
All of the staff and all of the clients. What could we do together to talk about race and privilege?
I like the idea because it's not the elephant in the room anymore if we do that. I at this point I don't feel I wouldn't want to lead that discussion. If you were there, I think you were, or one of the African American staff even could at least co-facilitate.
But do you think it's a good idea? Like, so yes, we could together design an experience for everybody of when they
Yeah.
were in the minority and when they were not in the minority and what that feels like.
Sure.
And we could invite him and his brother so that he would not be the only African American
Yeah,
person and he had a trusted other there.
I like that idea.
Do you like that idea? Yeah, and I'd be happy to facilitate it, or one of the staff, one of the African, we can poll people and see who's available to do that.
I did have another idea, which wouldn't go that direction, but kind of approach him at what does he really want out of this treatment program, and to get him to focus on what he can do to bring that about, rather than focusing outward on others. What is it that he wants, and how can he get there? And I guess if he brings up something about not trusting the system or something, we can try to accommodate that that concern. But everyone has their goals and objectives and what they can do. And I guess if he can focus on what he can do, then he's not focusing as much on what others are doing. So, I'd have to look at the notes to see if that's really been done yet with him. But he does have a treatment plan, and he has established goals. So, how do you think that would help?
I think that would help, but I think we might have to prove ourselves trustworthy first.
Yeah.
I think
Okay.
for him to really be able to, I think both things need to happen. So
Okay.
I think he needs to feel safe enough, and I don't think he feels safe enough yet to be able to defocus from safety. So I think everything we've been seeing from him is his attempt to maintain, to establish some kind of sense of safety, or find out if he's safe or whatever. I think he's sort of flailing around in his, here I am in this place and I don't know if these people are trustworthy and I don't have a lot of choice and control and it's scary. So,
that.
so if we do something that major, like have an entire, do a whole group about what it's like to be in the minority, and we all openly and honestly talk about our experiences of being in the minority, and we all, it's a way of saying, look, we are willing to go to fairly great lengths to prove ourselves trustworthy now.
I think that would speak volumes to him, really.
Yeah. And then once we've done that, then is the time to say, because he's now seen how far we'll go, so then he can think about what he can do in that context, and I think that would be more effective.
I like it.
Yeah, and I think we'd all learn a lot too. I think there's a lot for us to learn from him about race and about what it's like to be a minority, and I think
Sure.
giving him that, like sort of saying, we realize we have stuff to learn here, and you're going to be one of the teachers, and your brother can be a teacher too. And let's learn this together. That might be the best possible intervention. And so, does that make sense?
Absolutely.
Yeah.
I just wish it was my idea.
Well, the good news is next time it will be. So there was a lot about this that was your idea. I mean, so in this plan, there's a big piece of this that is your idea. And you actually allowed the idea by what you were thinking. So because you were so self-reflective, and because you talked about the trustworthy thing, and because you're willing to apologize and back up, all of that means that we can go to another level. Like if you were in a place of, I have to do what I said I was going to do, and it's all about the rules, and people have to follow the rules. If you stayed in that place, it would be very hard to come up with a creative solution. But because you weren't there, then we could really think outside the box about how we as a community can heal this division. And create a safe environment for anybody, and that way we learn and grow as a program.
Yeah, I'm just thinking about it now, and I think it would be great for everybody on the unit to do this. That's
right. Right, that's right. And the truth is, although it was my idea, it came from your self-reflection.
Thank you.
So I do totally appreciate how completely self-aware and willing you were to really explore this at this level, and that just makes me very hopeful about how we could evolve as a program.
Good.
That because you're here and you're able to do this kind of work, so then we can do this kind of work. So I totally appreciate your participation in this co-creative process, because that's what it is. Totally.
Well, I feel a lot better. I didn't know how this session would go today.
That's great. So you're going to do your apology, and that's okay. And you can, is there something you need about that? Do you need me to come with you?
No, being in the family that I'm in, I apologize a lot.
Okay. And you'll let him know that was a mistake, and no, we're not going to discharge him. And then why don't you wait a few minutes, let's meet with the staff and talk about this and design it a little, and then when you apologize to him, you can say, and here's what we have thought about, and we're wondering if you would be interested in us doing this.
That would help.
That would help, yeah. So that could be part of that conversation too, and we can see if he's up for it. Okay, and if not, we'll come up with something else.
Okay.
Okay. Thanks a lot, Mike. That
Sure.
was, this could be really great. Sometimes the best things come from the most difficult ones, and we should keep remembering that, right? Whenever we get to this place, we should keep remembering that we may, the best ideas and our ability to evolve comes from the difficult things. Thanks very much.
Okay.
Okay.
Thank you, too.
Great. This scenario also illustrates how to get out of a crisis-driven approach to things. In residential treatment, often a lot of what happens gets driven by crisis, and that can be a sort of negative influence on the climate. So in this scenario, as a supervisor, I have used my own self-regulation skills to really deal with my own feelings about what my supervisee, Mike, did the previous evening. By the time we sit down, I'm calm and see my job as modeling being calm and calming in a crisis. What I'm modeling here is also how Mike himself could work with a client if a client is in crisis or a client has done something wrong. So I'm using those skills and also modeling those self-regulation skills. There were a lot of choice points in this scenario, sort of pathways I went down and pathways I chose not to go down. So what I was prioritizing here is the safety of the client and also the safety of the climate in the residential program. Because of that, there were a couple of things I didn't address in this session because I have plenty of time to build Mike's competencies and can go back and do those pieces in the next supervision session or even the one after that. So the first road I didn't go down is to ask Mike about what else he might have done in the interaction with Clarence last night. So that's something I'm going to do later. I'm going to say, so okay, what did Clarence say that pushed your buttons? Why does that push your buttons? And what might you have done in that moment that might have prevented you from saying what you said to him about discharge? So we're going to go back there. The second thing that I didn't explore is using a trauma-informed lens to look at why Clarence was getting out of bed at night. So Mike was making the assumption that Clarence was breaking rules just to break rules, and I think that's rarely the case. It can be the case. But I think it would have been interesting, and I would do it sort of the following day or another day, to talk about what Mike thinks might be other reasons why the client was getting out of bed at night, and how he might explore that with the client rather than making assumptions that he was just breaking rules to break rules. One thing about Mike is that he exhibited an inordinate amount of self-awareness in this session. He actually raised the issue of race, and if he hadn't, I would have had to bring it up. So I would have said something like, do you think race had anything to do with what's going on with Clarence? But I didn't have to because Mike brought it up himself. And also, he clearly was doing a lot of self-reflecting about his own responses and reactions. If he hadn't been, I might have stayed there a really long time. I might have spent a lot of time exploring with him what he felt about Clarence, what he was feeling about Clarence that night, helping him to reflect on what were the inputs that resulted in his difficult interaction with Clarence. And so that got avoided, and we moved pretty quickly to talking about potential solutions because Mike was so self-aware. So with a less self-aware person, I would have had to deal with the exploration a little bit longer. Hi, Joyce. How are you?
I'm fine. How are you?
I'm good. So what's been going on?
Oh, it's been a lot of work. I've had some things going on with clients. Been really busy, making sure paperwork is up to par and giving my clients quality care.
Well, that's good. That's really good. I haven't seen you for a while.
Well, like I said, I've been really busy. Clients been having a lot going on. So It's been a lot of emergencies and just been busy, staying on top of things.
Yeah, so last time we were supposed to meet, I got a message that you had a client emergency?
Yeah, a client had a situation where they had a crisis. They were about to be put out, and they were really struggling. And I needed to make sure they were okay and tap them into some services. So I've been really busy.
But did that work out okay, that situation?
Well, right now they're on a waiting list for other housing and funding from some resources. So I did tap them into some things, and I processed with them. And so they seem pretty calm and okay about the wait process. But it's been going good.
You say it's been really busy. Does it seem busier to you than it normally is?
I think I'm used to it. I've learned to adjust my time because, I work a couple of late hours here and there, but I got to make sure my clients are okay. Make sure they have what they need.
You do a really good job of taking care of your clients. There's no question that you're very good at that, and that they really appreciate that about you. You're definitely you definitely do a good job of building relationships with clients, and I know you care about them, and I know they can feel that, and I know that, you know, that really helps us in terms of keeping people engaged in the recovery process. And so you've been doing, you know, I mean, you do really, really good work with your clients.
Thank you. I'm glad to hear that. I try. I do try to spend a lot of time with them. I try to manage it well, but sometimes, like I said, these crises, boy, do they have crises. But, you know, I try to be there for them.
Mm-hmm. Yeah, well, you do that really well. And so I'm wondering how the death of Shirley has affected you.
I'm okay. I just keep, you know, I keep busy.
Yeah.
Try to make sure I'm meeting the needs of the other clients, you know. Death happens.
I know that death happens, but Shirley was a client you saw for a really long time. And I know, because of how closely you work with people, that her death is bound to have some impact on you. I mean, she didn't work with me, and I feel really sad that that happened, and other staff too. And, you know, so it's bound to have some impact on you.
Well, you know, I've come to terms with death, you know. It's a part of life, and I just accept it. And, you know, I am sad, but I keep moving, you know. Mm-hmm. I keep busy. The other clients are here. I got to keep moving.
Mm-hmm. So tell me about the sad part, though.
Well, you know, I think I really wished I could have helped her more. It's sad it happened, you know, but it is what it is.
When you say you really wish you could have helped her more, do you ever have thoughts like there was something you could have done or should have done?
I think I'm going to always think like that, yeah. There is some things I think I should have done. I should have been there. But, you know, like I said, it is what it is. It's death. It's part of life. We live, you know, we're born, we live, we die. It's part of our life cycle, and I've learned to accept that. It's just what it is.
Right, but accepting it doesn't mean we don't have feelings about it, does it? So the sad feelings are still there, even though we accept that people die.
I don't know what you're looking for, because I'm still working. I'm handling it, you know.
Of course
I'm
you
doing
are.
my job.
And yeah, I'm not saying that you're not doing anything. I'm not saying you're doing anything wrong.
Okay.
I'm not saying it. Although one of my thoughts, and this is just me, so you know, I could be crazy, but I worry that the constant moving and the focus on the work, that in that process you're not taking time to take care of yourself around what this feels like. That's my concern.
Well, I don't think you should worry about that. I'm doing okay.
So where do you allow yourself to deal with the feelings that come up? How do you?
I don't know. I work. I work. I go home. Then I work at home. I take care of my kids. I make sure dinner's done. I go to the football games, and I work. I keep busy. Busy. Busy's good.
All right. So that's one way and that's good that you can do that. I mean, there's something positive and productive about that. So is there, like in the past, when you've had a loss or a difficult situation, what has helped you in terms of letting yourself feel your feelings and grieve? Where are the places in your life where you've done that?
Typically, I've always worked. I've been a protector. Mm-hmm. I've been the strong person in my family for years. So I can't really say that I've had time to grieve or to. Someone's always got to be strong. Someone's always got to be able to keep moving on. And that's been my role in my life as a child and growing up. It's all I've ever been able to do. So I thought I was handling things pretty well.
No one is saying you're not handling them well, and it's wonderful and remarkable that you've been that strong in your life, and there certainly is a place for that, and that's an admirable trait. But I'm wondering about the sadder part of you, the younger part of you that might need some caretaking at this time, and whether there's room for her too.
I don't know. I don't know. I don't know if I let her out, if I allow myself to be sad, how do I come back? How do I come back to deal with the next crisis or the next situation?
So some part of you is afraid that if you let yourself grieve, that will be endless.
Yeah.
Yeah. Well, I just would like you to sit with that question. Do you think there's a downside to not letting yourself grieve?
I don't know. I've never thought about that.
So I'd just like you to sit with that question and to think about what supports, maybe ask other people what they do. So some people would have someone that they would talk to about the loss part. Some people would do a ritual or go to church or, but there are ways that people allow themselves to grieve. And although I think many people have that feeling, like maybe I'll never be done, the truth about grief is it has a life and a death too. So just like you said, death is part of life,
Right.
Grief is part of life, and it has a trajectory. You'll feel it and let it go over time. And there's no saying what that time is, but I think there is some loss in not dealing with that part. But I'm not saying you have to do it. I'm just saying that if I were you, I would sit with that question. And partly I'm saying because I think if people don't deal with their grief, and we all have to do it, that eventually they burn out on this work. That they start to close their hearts because it's too hard, that it builds up over time. Whereas if they take the time to let themselves feel it and let it go, that people will do better in the long run.
Well, how do you suggest that I grieve? I mean, I could write her a letter. I could write her a letter.
That would be a way.
Or better yet, a poem.
Yeah, that would be a way.
Yeah.
And maybe you could share that poem with someone who's a support. I'd be willing to hear it, or if you like, we could have you say it at a clinical supervision for everybody. That's up to you. But I'd also like you to get some support and some witnessing for that so that you're not alone with the grief. Grief is harder if you try to do it all alone, and better if you don't.
I'll take some time to think about that.
Thank you. Thank you so much for being willing to have this conversation with me. I know it wasn't what you were expecting. I mean, I think you're a great employee. I think you do beautiful work. And I want you to be able to do beautiful work for a long time. And grief is one of those things that if you don't deal with it, it does tend to have consequences in the long run. So I totally appreciate your being open to consider some other things that you might do so that the grief doesn't get stuck in there.
Thank you for the suggestions. Thank you for noticing. I never realized I wasn't paying attention to myself.
That's
So
great.
That's
great.
helpful.
Thanks very much. This was a great conversation, and I totally appreciate your willingness to engage in it.
Thank you.
Great. So I'll see you next week.
Okay.
Take care.
Bye-bye.
In this scenario, Joyce does not seem to be aware that she is not attending to her feelings about the loss of the client. And when the scenario begins, I try to bring that to her awareness several times, but she seems to be convinced that she is coping in the way that works for her, and she's very focused on how well that's working. As a result, I spend a lot of time validating all of the benefits of the way that she's working, both the benefits to her and the benefits to the organization. And I reassure her a number of times that she isn't doing anything wrong, although I do want to explore it further. Eventually, when my probes don't work, I have to be a little bit more direct, and I gently talk to her about my concern for her and the possibility that she could develop burnout. And she does respond well to that. One of the things that this models is what you would do with a client in pre-contemplation, someone who isn't thinking about the downside of what they're doing. So Joyce gets to have this modeled for her and has the experience of what it's like to be at the other end of that. Because I want her to slow down and make space for her own feelings, I go kind of slowly. And I actually raise questions and then suggest that she just sit with them. Actually, what I want her to sit with are her feelings, but if she sat with the questions, the feelings would come as well. That actually works pretty well, because having said that a couple of times and having agreed to sit with the questions, she actually then does develop an action plan for dealing with her unaddressed grief. This scenario does illustrate the importance of talking to staff about the impact that the work is having on them and on helping them to pay attention to their own self-care. It is part of trauma-informed care and a supervisor's job to be paying attention to the impact of the work on the people that they supervise and to teach them to pay attention to it themselves. As we have seen, trauma-informed supervision is both a way of modeling trauma-informed interactions and building trauma competencies. These scenarios demonstrate the provision of a safe, empowering relationship while also enhancing supervisee competence. This is most apparent in the first scenario with Kelly, in which she's held accountable but creates her own plan for correcting the deficiency and feels safe and supported with her supervisor even while addressing something difficult. The second scenario with Mike illustrates how a calm and calming supervisor can help a supervisee to address a crisis in a way that feels okay to the supervisee and that also promotes a safe climate in which both staff and clients feel like they have a voice in what happens. And that is another principle of trauma-informed care. In the third scenario, the supervisor helps Joyce to pay attention to her own needs and her self-care and addresses the issue of burnout. And so that's another really important part of being a trauma-informed supervisor. Sometimes staff will go to a training on trauma-informed care and come back to their agency and try to implement what they've learned. But if their supervision isn't trauma-informed, they can have difficulty doing that. They may not really know what trauma-informed care will look like, what those interactions with clients should look like. If they have trauma-informed supervision in addition to training, then trauma-informed interactions are modeled, and then staff are supported in trauma competencies and their development. So that we believe that a combination of three things really: providing trauma-informed training for all staff, providing trauma-informed supervision, and also for an organization to have a trauma-informed strategic plan, changing your policies and procedures to make them more trauma-informed. Doing all those three things is really the best environment to change to a culture of trauma-informed care.